When most people think about healthy aging, they focus on diet, exercise, and medical checkups. But there's one factor that affects your health for 8 hours every single night that hardly anyone talks about: the position you sleep in. For decades, we've been told that as long as we get enough sleep, the position doesn't matter. But groundbreaking research from sleep medicine specialists and gerontologists reveals that after age 60, certain sleep positions can silently accelerate aging, increase your risk of stroke, and even damage your brain while you rest. Tonight, as you lay your head on your pillow, you might unknowingly be choosing a position that's working against your body's natural healing processes. The position I'm about to reveal isn't just uncomfortable, it's actively harming your cardiovascular system, disrupting your brain's ability to clear toxins, and setting you up for serious health complications that could have been easily prevented. Here's what's happening inside your body that changes everything about sleep positioning after 60. As we age, our cardiovascular system undergoes significant changes. Blood vessels become less elastic, heart muscle may weaken slightly, and circulation naturally becomes less efficient. Your lymphatic system, which acts as your body's drainage network, also slows down. Most critically, your brain's glymphatic system, the cleanup crew that removes toxic proteins while you sleep, becomes less effective with age. These changes mean that the sleep position that worked perfectly fine in your 30s or 40s might now be creating a perfect storm of health problems. Your body simply doesn't have the same resilience to overcome the physical stresses that certain positions create. When you compound this with the fact that many people over 60 take medications that can affect circulation or blood pressure, the stakes become even higher. The most concerning position that's causing hidden damage is sleeping flat on your back with your head at the same level as your body. This position, which many people consider natural and comfortable, creates a cascade of problems that become progressively worse after age 60. When you lie completely flat, several critical processes that your body depends on for repair and maintenance become compromised. First, let's understand what happens to your circulation in this position. When you're flat on your back, your heart has to work harder to pump blood throughout your body against gravity. This increased workload becomes particularly problematic if you have any underlying cardiovascular issues, even minor ones that haven't been diagnosed yet. The extra strain on your heart during what should be its rest period can contribute to elevated blood pressure and increased stress on your cardiovascular system. But the circulation problem goes deeper than just your heart. When you sleep flat, blood can pool in certain areas of your body, particularly in your lower extremities. This pooling effect can increase your risk of developing blood clots, especially if you're taking medications that affect blood clotting, or if you have conditions like diabetes that impact circulation. For people over 60, who may already have slightly compromised circulation, this positional stress can be the tipping point that leads to serious complications. The brain-related consequences of sleeping flat are perhaps even more alarming. Recent research has revealed that our brains have their own waste removal system called the glymphatic system, which works most effectively when we sleep. This system is responsible for clearing out toxic proteins, including those associated with Alzheimer's disease and other forms of dementia. However, this cleaning process works best when your head is elevated at a specific angle that promotes optimal fluid flow. When you sleep completely flat, the glymphatic system cannot function at its peak efficiency. The cerebrospinal fluid that carries away brain toxins doesn't flow as effectively, meaning that harmful proteins may accumulate in your brain tissue overnight instead of being cleared away. Over months and years, this reduced cleaning efficiency could contribute to cognitive decline and increase your risk of neurodegenerative diseases. Studies using advanced brain imaging have shown that people who sleep with their heads slightly elevated have significantly better glymphatic function compared to those who sleep flat. The optimal angle appears to be between 7 and 15 degrees of elevation, which allows gravity to assist in the drainage process while maintaining comfortable blood flow to the brain. The respiratory complications from sleeping flat become more pronounced with age as well. When you lie completely horizontal, your airway structures can shift in ways that partially obstruct breathing. This is particularly problematic for people over 60, whose throat muscles and supporting tissues have naturally lost some tone over time. Even if you don't have diagnosed sleep apnea, sleeping flat can cause subtle breathing disruptions that fragment your sleep and reduce oxygen levels throughout the night. These micro-awakenings, which you might not even remember, prevent your body from entering the deepest, most restorative stages of sleep. During these deep sleep phases, your body releases growth hormone, consolidates memories, and performs critical repair functions. When flat sleeping disrupts these processes, you wake up feeling less rested, and your body doesn't get the full regenerative benefits that quality sleep provides. The impact on your digestive system is another hidden consequence of flat sleeping that becomes more significant after 60. When you lie completely horizontal, stomach acid can more easily travel upward into your esophagus, increasing your risk of acid reflux and heartburn. This is particularly problematic for older adults, who often produce less saliva during sleep. Saliva normally helps neutralize acid that does make its way into the esophagus, so reduced saliva production combined with flat positioning creates a perfect environment for acid damage. Chronic acid reflux doesn't just cause discomfort. It can lead to serious complications including esophageal inflammation, increased risk of respiratory problems if acid is aspirated into the lungs, and even an increased risk of esophageal cancer over time. For people taking common medications like blood thinners or anti-inflammatory drugs, acid reflux can also increase the risk of gastrointestinal bleeding. Your spine and musculoskeletal system also suffer from prolonged flat sleeping, especially as age-related changes make these structures more vulnerable. When you sleep flat without proper support, your spine may not maintain its natural curves. This can lead to increased pressure on spinal discs and joints, contributing to morning stiffness and pain that many people incorrectly assume is just a normal part of aging. The cervical spine, or neck region, is particularly affected. Without proper elevation and support, the natural curve of your neck can become straightened or even reversed during sleep. Over time, this can contribute to cervical disc problems, nerve compression, and chronic neck pain. For people who already have arthritis or other age-related joint changes, sleeping in a position that doesn't support proper spinal alignment can accelerate the progression of these conditions. Now, you might be wondering what position you should be sleeping in instead. The research consistently points to a slightly elevated position as optimal for people over 60. This doesn't mean sleeping sitting up, which creates its own problems, but rather maintaining a gentle incline that elevates your head and upper body between 7 and 15 degrees. The easiest way to achieve this is by using an adjustable bed base, which allows you to customize your elevation to the exact angle that feels most comfortable while still providing the health benefits. If an adjustable base isn't feasible, you can create a similar effect by using a wedge pillow specifically designed for this purpose, or by placing risers under the head of your bed frame to create a gentle incline. This elevated position provides multiple benefits simultaneously. It allows your heart to pump more efficiently, reducing the workload during sleep. It promotes better drainage of the glymphatic system, helping your brain clear toxins more effectively. It reduces the likelihood of acid reflux by keeping stomach contents where they belong. And it maintains better airway alignment, reducing the risk of breathing disruptions. The circulation benefits of elevated sleeping become apparent relatively quickly. Many people notice that they wake up feeling less congested, with less facial puffiness, and without the feeling of heaviness in their legs that can occur after a night of flat sleeping. These changes reflect improved fluid dynamics throughout the body during sleep. For the brain benefits, the timeline is longer, but potentially more significant. While you won't notice immediate changes in cognitive function, maintaining better glymphatic drainage night after night could contribute to preserved mental sharpness over time. Some sleep studies have shown measurable improvements in memory consolidation tests after just a few weeks of elevated sleeping. There are some important considerations when transitioning to elevated sleeping. The change should be gradual. Start with just a few degrees of elevation and slowly increase over several weeks. This allows your body to adapt to the new position without causing discomfort or sleep disruption. Some people initially experience mild back discomfort as their muscles adjust to the new alignment, but this typically resolves within a week or two. It's also crucial to maintain proper leg elevation if you're raising your upper body. If only your head and shoulders are elevated while your legs remain flat, you can create pressure points and circulation issues in your lower body. The ideal setup elevates your entire body from head to toe at a gentle, consistent angle. The pillow situation requires adjustment as well. When sleeping elevated, you typically need less pillow support, since the incline naturally positions your head and neck appropriately. Using too many pillows on top of elevation can actually create neck strain and interfere with the benefits you're trying to achieve. For people who share a bed, the transition to elevated sleeping might require some coordination. Adjustable bases that allow each side of the bed to be positioned independently are ideal, but if that's not possible, couples may need to experiment with individual wedge pillows or other solutions that allow both partners to achieve optimal positioning. There are certain medical conditions where elevated sleeping is particularly beneficial. People with congestive heart failure often find dramatic improvement in their sleep quality and breathing when they sleep elevated. Those with acid reflux disease typically experience significant symptom reduction. Individuals with sinus congestion or allergies often breathe more clearly when elevated. And people recovering from certain surgeries or medical procedures may be specifically instructed to sleep elevated to promote healing. However, there are also some situations where elevated sleeping might need to be modified or avoided. People with certain spinal conditions might need specific positioning that differs from the general recommendations. Those with severe hip or knee arthritis might find that elevation exacerbates their joint pain. Anyone with significant mobility limitations should work with their healthcare provider to determine the safest and most comfortable sleeping position. The key is to pay attention to how you feel both during the night and in the morning. Quality sleep should leave you feeling refreshed and comfortable when you wake up. If you're experiencing increased pain, restlessness, or morning fatigue after changing your sleep position, it's worth reassessing your setup or consulting with a healthcare provider who understands sleep medicine. Beyond the immediate health benefits, proper sleep positioning is an investment in your long-term independence and quality of life. The cardiovascular, neurological, and musculoskeletal benefits of elevated sleeping can contribute to maintaining your physical and mental function as you age. When you consider that you spend roughly a third of your life sleeping, optimizing those hours becomes one of the most efficient ways to support your overall health. The research on sleep positioning and aging is still evolving, but the current evidence strongly suggests that the flat sleeping position that many people default to is not optimal for health after age 60. The physiological changes that come with aging make us more vulnerable to the negative effects of poor sleep positioning, while also making the benefits of optimal positioning more pronounced. Making this change doesn't require expensive equipment or medical intervention. It's a simple modification that you can implement tonight. Start with a gentle elevation. Pay attention to how your body responds, and adjust gradually until you find the position that leaves you feeling most rested and comfortable. Your sleep position might seem like a small detail in the grand scheme of health and wellness, but for people over 60, it's actually one of the most controllable factors that can significantly impact your cardiovascular health, brain function, and overall quality of life. The 8 hours you spend sleeping each night can either work for your health or against it. The choice is literally in your hands, or rather, in how you position your body when you lay down to rest. Remember that good health after 60 isn't just about adding years to your life, but about adding life to your years. Quality sleep in the proper position is one of the foundational elements that makes both possible. Tonight, when you prepare for bed, you have the opportunity to make a simple change that could protect your health, preserve your cognitive function, and help ensure that you wake up each morning ready to live fully and independently. The position you choose isn't just about comfort. It's about giving your body the best possible environment to heal, repair, and prepare for another day of vibrant living. After 60, every night of quality sleep in the optimal position is an investment in your future health and independence.